you're a pet owner, you know sometimes it's hard to know what your pet is trying to tell you. A happy wagging tail, that's easy. But other behavior, not so much.
Yeah, sometimes it is curious. Wouldn't it be great if we were pet psychics so we could read our dog's mind and figure out why it misbehaves or has a sudden change in personality? Veterinarian Mike Hutchinson says behavioral medicine is becoming its own specialty for vets nowadays. He is here to help us with 2 cases involving dogs in our KDKA family. Dr. Mike, thanks for being here.
You're welcome.
So these are some curious cases, but I think that we can all relate. If you have a pet, you know that sometimes out of nowhere it seems like they start to change their behavior.
Sure.
And one of our directors, Joe, he said that their 9-year-old Boston Terrier started to act bizarre, very anxious, very clingy, when normally this dog could sit outside, relax on the deck for hours at a time, not need the attention, and now all of a sudden does not want to leave the side of his wife, Joe's wife. Used to go in the crate just fine, and they don't know why. They're looking at this woodpecker that's pecking on the side of the house, but the woodpecker's been there for 6 years.
Yeah, so, and that's a very common story. Now, you said 9 years of age, and they age just like we do. Their brain starts to age, and so you've heard of Alzheimer's, of course, in people, and we believe that's due to the brain not getting enough sugar sometimes, glucose, not enough fat maybe, chronic inflammation. Sometimes they have oxidative stress, things like that. Well, dogs are exposed to the same types of things, and so they get a dysfunction just like we do. It's similar to Alzheimer's, and it's a cognitive behavior. They call it cognitive disorder syndrome, CDS. And what happens in these dogs is just what you're explaining. All of a sudden, they get very anxious, their behavior changes, they've forgotten things that they've learned, like going in the crate, you know, things that are very simple. Sometimes they just stare off in space and they act bizarre. And there are things we can do to slow that down, and there are diets even that have like special oils in the medium chain triglycerides, MCT oil. People have heard about that, and some diet fads, but it's very good for the brain health. There are some medicines that we can give to try to slow that down. And there's questionnaires that we go through with owners that will ask questions on different parts of their life, and people can go online and look those up. Purina has a really good questionnaire tool, and you can answer those questions, just how your dog's behavior is, or your cat's, and you can almost self-diagnose that, and then we can get help. I get concerned, but there are things that we can do to help them along, and remember, they age just like we do, and 9 years is usually about that age where we start to see it.
Turn. I remember when my mom it was recommended that they put their dog on anti-anxiety medicine, and Joe also said that that was something that the vet had said, aside from Benadryl being used to calm.
Well, I always like to, first of all, rule out disease. We all want to look and see if we can find anything that's wrong, and if there's something wrong, we'd treat it. So Joe will go to the veterinarian, it sounds like he already is, and find out, make sure all the blood tests are normal and everything else in his life is normal. That would be a whole different situation. Like a brain tumor, of course, could cause crazy, bizarre signs, but that's rare. It's not that common in dogs, thank goodness. So things like clomipramine is Clomicalm, they call it, is for calming dogs. We have a whole bunch of calming agents. We even have probiotics that work really well now to calm dogs down, anxiety and things like that. I have 3 pages of calming agents, 2 of which are all natural. So we try those things to see if it helps, but unfortunately, if they have this type of disorder, we usually have to go to things that are a little bit stronger. There are some, like in people, they use L-Deprenyl for Alzheimer's, and we have the similar drug, the same drug actually, it's called Sedulene in animals, that will sometimes help dogs. It might take 2 or 3 months, but it helps them.
All right, we have case number 2. So this is CJ's dog here at KDK. CJ works here. And the dog's name is Danny, a 9-month-old Beagle mix, likes to tear up his and other dogs' beds, really any dog bed that is around. So you're seeing a picture of Danny there and what Danny is capable of doing. Dr. Mike, what can we tell CJ?
Now, this is more along my lines of the problems that you like to help with good training. And sometimes people, we have trainers out there, dog trainers that are very, very good. And now we have dog behaviorists that it's actually becoming a discipline with board certification. So we're learning a lot about why dogs act out and act like these different crazy behaviors. But I think in a 9-month-old puppy like him, that's a training issue. Okay. And remember, if we don't give dogs a job to do, they'll create their own job, like tearing things up in the
Yeah,
house.
clearly Danny has created his own job.
So
we
you
want to
wanna-
keep them busy.
You want to create a job. So how do you do that in a house?
So like,
pet?
say you have a border collie, you have something like that. Well, we go outside and let's make him a frisbee catcher. Let's do something that he loves to do. So you you pick up that frisbee. He knows what time it is. It's time to go out. And so you just give him things to do. Give him commands. Teach him new tricks. It's always fun for dogs, especially smart dogs that are hyper. They want your attention. They want to please you, and so help them out and teach them. And if you don't, believe me, they will create their own job.
Like
Let me
tearing
ask you
things up.
really quickly about a dog I know. Her name is Molly, and she would go underneath the area rugs and eat the carpet pad. And she does it for every pad they get, every area rug. Is that because she needs a job?
Well, maybe, but maybe they need a wood floor. I don't know.
Okay.
But those are
Easy
things
solution,
that
right?
can cause lots of obstructions and things like
Right.
that. They build up inside them. And so, yeah, those are dogs that really need to begin at the beginning and start over, I should say, where we put them on a leash. We have them under control all the time. When we take them out of the crate, if they're crate, we're starting to train them to do what we want them to do. Time becomes an issue for a lot of people, especially when both partners are working, and so it makes it very, very hard to be there all the time. So then maybe we should be considering crate training, maybe some visitors, doggy day camp, things like that can break up their day so that they're less destructive.
Dr. Mike, thanks so much.
Hey,
as
you're welcome.
always.
Thanks to Dr. Mike Hutchinson of Animal General in Cranberry. He's a regular contributor on PTL with his Ask Dr. Mike segment. You can also listen to his podcast, and you can find him on KDK Radio. He's everywhere.
He is everywhere.